Hey everyone, Dr. Richard Lai here with Study Acupuncture with me. Now this episode is all about the medial side of the knee, and there's a video version of this on YouTube as well, but I promise you, even for those of you that are listening to this in podcast format, you're still going to find value out of this episode. So before we get into the medial side of the knee and more, let's hear a quick word from our sponsor. This episode is sponsored by me. Please go to www.studyacuwithme.com to sign up for my email list. When you sign up for my email list, you get free study guides right to your email. So go to www.studyacuwithme.com to sign up today. All right, so first, let's talk about the anatomy of the knee, because anatomy is really, really important. We're built in a specific way, so we function in a specific way. Now, when there's a breakdown, whether that breakdown is internal or external, that's when problems like pain can come about. So, what's the anatomy of the knee? First of all, we know that the knee is a hinge joint, and you've worked with hinges thousands of times in your life. In fact, if you've opened a door today, you've worked with a hinge joint. And the knee itself is a hinge joint. A hinge joint allows for movement in one plane. So with the knee, you have flexion and you have extension, just like a door swings open and swings closed. Now, with the knee, there actually is a little bit of internal and external rotation. It's really slight, but it happens when the knee is in full extension and full flexion. Because in order to unlock the knee so that it can swing into flexion or extension, you have to have that little bit of internal and external rotation. But it doesn't actually make any real big movements, it's just a little bit of movement. So far, we already went over that the knee is a hinge joint and that it can do flexion and extension. Flexion is, by the way, when you bend the knee, and extension is when you make the knee straight. All right, now let's talk about bony anatomy. So the knee is made up of two parts. We've got the femur bone and we've got our tibia, and they connect, making a tibiofemoral joint. Now that's a fancy anatomical word for knee joint. Now these two bones, they're connected to each other through ligaments and through tendons. Ligaments are connective tissues that connect bones to bones, and tendons are the ends of muscles, and they connect muscle to bone. And in the knee, you have ligaments on both sides. You've also got ligaments on the inside. So on the lateral side of the knee, you have a ligament there called the lateral collateral ligament. On the inside or the medial side of the knee, you have a ligament there called the medial collateral ligament. So you can also call these your LCL and your MCL. Now what do? They help to strengthen the sides of your knee. They act almost like a bracket so that your knee can just flex and extend, and it won't have any sideways motions. Because if there's sideways motions with your knee, that means something's wrong with your leg. That means either your MCL or your LCL or both are probably destroyed. Now, on the inside of your knee, you have two cruciate ligaments. You have an anterior cruciate ligament and you have a posterior cruciate ligament. And they're called cruciates because they form an X inside the knee. Now, these two ligaments, which again, ligaments connect bone to bone and tendons connect that muscle to the bone. Now, these ligaments, they help to stabilize your knee as you're swinging it into flexion and extension. They also have another really important job, which is to prevent anterior displacement and posterior displacement of your tibia. Now, your tibia is your shin bone. Now, this just means that they help to make sure that the tibia doesn't shoot too far forward or too far back. In other words, anterior or posterior. Now, let's take a guess which one helps to prevent anterior displacement and which one helps to prevent posterior displacement. Which, simply enough, the anterior cruciate ligament is going to help our tibia from going too far anterior. And then the posterior cruciate ligament is going to help prevent the tibia from moving too far posterior or back. So that's the ACL and that's the PCL. And we already also went over the MCL and the LCL. Now, inside the knee, there's also the meniscus. The meniscus covers the top of the tibia. The top of the tibia is also known as our tibial plateau. Now, this covering, it covers both the medial side and the lateral side of the tibial plateau, and it acts as a shock absorber. So when you're jumping, you're landing, and it's acting as a shock absorber for your knees. Now, the meniscus also helps to stabilize your knee when you're bending and you're straightening your knee, because the meniscus makes a groove that your thigh bone can bend through. All right, now let's talk about the muscles surrounding the knee. So with the knee, you have muscles in the front, you have muscles on the back, you also have muscles on the side. And you can break down your studying and your understanding of the knee and those muscles into 4 different sections. So first, we have the front section. The front section, we've got our quadriceps. Next, we have our middle section, which is also known as our adductors. And then in the back, we have our hamstrings. On the side, we have this really long band called the IT band, the iliotibial band. So let's start with the easiest one, which is the front. So in the front, we've got our quadriceps. The quadriceps are 4 muscles that help you to extend your knee, which means to make your knee straight. So when you're kicking someone, you're making your knee straight as your leg is going towards them. You're activating your quads. And in fact, your quads also help with hip flexion. And then in the front of your thigh, you also have this really long, thin muscle that's called your sartorius. Now, I remember my anatomy teacher at university, she called this one the dog poop muscle. And that's because the actions of this muscle are the exact actions for when you're looking at the bottom of your shoe after having just stepped in dog poo. Which, when you step in dog poo and you want to check the bottom of your shoe, what do? You flex your hip, you externally rotate, and you abduct your leg so that you can see the bottom of your foot. So sartorius muscle is the dog poop muscle. All right, so next we have our adductors. Our adductors are on the inner side of our thigh, and they help with adduction. Now, adduction is adduction, which is bringing your legs together. So they're adding to each other. And so you've got muscles there like the adductor longus, the adductor magnus, and you've also got a muscle there called the gracilis. Now, the gracilis muscle, it does go past the knee. So when it's activated when you're adducting your legs, it's actually also helpful in flexing your knee because it goes past your knee. And you'll see why I mentioned this gracilis in a few minutes. All right, now in the back of our thigh, we've got our hamstrings. Now, there are 3 hamstring muscles. We've got our semitendinosus, we've got our semimembranosus, and we've got our biceps femoris. So let's say that again. We have semitendinosus, semimembranosus, and biceps femoris. Now, these muscles, they originate or they start at our ischial tuberosity, which the ischial tuberosity is our sit bones. And from there, they go all the way down the back of our leg and cross the knee joint. So they act on the knee by flexing the knee. Now, the semimembranosus and the semitendinosus are on the medial sides of our knee, and the biceps femoris is on the lateral side of our knee. All right, now let's talk about the outside of our thigh. So on the outside of our thigh, we have the IT band. Now, this IT band, it starts at our hip and it goes all the way down the outside of our thigh, and it connects right below the knee joint. And this band basically just gives your leg support on the outer side of your knee joint. All right, so now let's hone in on the medial side of the knee. On the medial side of the knee, what are we working with? Let's work from deep to superficial. So first in this episode, what did we talk about? We talked about how the knee is a hinge joint. Then we talked about the bones. So what bones do we have there on the medial side of the knee? We have our femur, and we have our tibia. And then we also have our ligaments, right? Our ligaments connect bones to bones. So we're talking about the medial side of the knee. So we have our medial collateral ligaments. We also have our meniscus. Our meniscus covers that tibial plateau. It's on the lateral side and it's on the medial side. So on the medial side, it's called the medial meniscus. Next, we've got muscles and we've got tendons. So on the medial side of the knee, we have a couple tendons there. We have sartorius, which is our dog poop muscle. We have our gracilis, which is one of our adductors. We've also got semitendinosus and semimembranosus, which is our hamstrings. So the first 3 that we talked about, the sartorius, the gracilis, and the semitendinosus. Together, you can call them the pes and serine. Now, pes and serine sounds scary, but it's actually just Latin for the word goose's foot, because these 3 muscles, when they insert on the medial side of the knee, together they look sort of like webbed feet, the webbed feet of a goose. So sartorius, gracilis, semitendinosus, together they're like Swedish House Mafia, except their DJ name is the pes and serine. All right, now let's talk about the acupuncture points specific to this area. Now, the 2 that we're going to talk about are liver 8 and kidney 10. Now, there's a lot of drama for your mama with these 2 points when it comes to locating these points. And there are actually some really skilled acupuncturists who have been in the game for a long time where they just feel where the points are because they have so much experience. So they know exactly where it is and where the chi is gathering for those 2 points. Now, for me, I have a really analytical brain. So my process for finding these points are based on anatomy. So for example, let's look at the location description for liver 8. When you look at the description for liver 8, you're going to see 3 important things. Number 1, it's going to say superior to the medial end of the popliteal crease. Number 2, it's going to say in the depression anterior to the tendons of semitendinosus and semimembranosus. And in number 3, it's going to say 1 soon anterior to kidney 10. Now, we have to go look at kidney 10 then. So with kidney 10, that description tells us 2 important things. It says, number 1, at the medial end of the popliteal crease. And then number 2, between the tendons of semitendinosus and semimembranosus. So one is anterior and one is between. All right, and that's the end of this episode. So make sure you sign up for my email list at www.studyacuvithme.com so you can get free study guides with each theory-based episode. All right, everyone, until next time, God bless and happy studying.